An alarming new report highlights the problem of opioid addiction among healthcare professionals. The report out today shows more than 44 million doses of legally prescribed opioids were stolen last year. Now, that is an increase of 126% from 2017. Doctors and nurses were to blame most of the time. Errol Barnett spoke to a patient and a doctor about the impact of so-called drug diversion. Errol, good morning.
Good morning. Look, this report is by a data firm and based solely on public information like news, reports, and police records. So what we're about to show you is likely just a tip of the iceberg. The report found nationwide patients are at an increased risk of being seen by a doctor or nurse misusing opioids.
I'm not scared anymore.
For 3 years while practicing in Tennessee, Dr. Steven Lloyd was among healthcare workers addicted to opioids and treating patients at the same time.
Addiction has the same prevalence no matter what profession you are. Doctors, lawyers, judges, politicians.
It also consumed his personal life. In this image, while coach of his son's Little League team, Dr. Lloyd was high on opioids.
Had a lot of education. The weird thing is almost no education on addiction.
His dependence began after an attempt to self-medicate for anxiety and depression.
What I didn't realize was how quickly it would escalate, going from that half of a 5 milligram Lortab to within 3 years about 500 milligrams of OxyContin a day.
That's about how many pills a day?
It's about 100 Vicodin.
Lloyd's long hours, high stress, and easy access led to plots to take his patients' drugs.
There was no requirements on what happened to those pills. They could go down the toilet or they could go in my pocket.
Lloyd has been clean for 15 years and now works to help other healthcare workers battling addiction. Lauren LaLanne's life was put at risk by her healthcare technician who was addicted to painkillers.
I was jaundiced. I was very, very fatigued.
When LaLanne went to the hospital for kidney surgery in 2009, she was shocked when left with hepatitis C and a liver infection. Technician Kristen Parker infected LaLanne and at least 18 others by stealing their pain medication and leaving contaminated syringes for reuse. She's now serving 30 years in prison.
A system is broken, and someone who might be addicted to some painkillers is like a kid in a candy store.
Now get this, LaLanne discovered during the trial that Parker, the technician, was previously reported for diverting drugs at another hospital, but that information is protected by healthcare privacy laws, so patients would have no clue. The Justice Department has a new opioid addiction detection unit, but that was only launched in less than a third of the country. Gayle?
Errol, thank you. Good to have you in the studio.